Hello everyone, I am Professor C.N. Balakrishnan Nambiar. This video is prepared for the benefit of MCFT students of IGNOU as requested by the principal of MCT Training College, Professor M.P. Abdusalam. This video is based on the paper 404 of block 1. As you know, this block consists of 4 units based on professional issues in counseling and psychotherapy. These units are: number 1, essentials for a counselor and psychotherapist. Unit 2, self of the counselor and psychotherapist. Unit 3, therapist, counselor or client relationship. And 4, professional approaches and ethics in counseling. Before straightaway entering to Unit 1, I think it's desirable and perhaps essential to say something about counseling. You know, this term counseling and guidance, usually people used to say guidance and counseling. They are interchangeably used by many persons, sometimes synonymously used. But they are different. Guidance is an umbrella term. It consists of institutions like employment bureaus in universities and employment offices, pamphlets prepared for this purpose, career programs organized by various organizations, NGOs, etc., trained personnel, books based on this, publications, talks on media, and a great lot of such things can be subsumed to the broad term guidance. But counseling is one of the many strategies to render guidance. It's a person-to-person interaction, either directly or over the phone or using teleconferencing. However, it is a face-to-face interaction between the counselor and the counselee. In other words, the therapist and the client. These words are used interchangeably. Counselor is the therapist. Counselee is the person who receives counseling. Next important point I want to emphasize is that while guidance is prospective, futuristic oriented, every program in guidance is meant for the future of the client, either to select a course for study or an employment or to solve a problem, either personal or academic. So it's meant for the future, to improve the performances in the future. Whereas counseling is both prospective and retrospective, and I would add introspective. This is very important, I believe. In counseling, when I say retrospective, we are analyzing the past of the counselee. What led to the situation? Then only we'll be able to understand the etiology of the problem he encounters. So, we have to look into the past. Perhaps even from childhood experiences we have to explore. By introspective, I mean looking to one's own experiences, The counselee is enabled to look and evaluate, enumerate his own personal experiences and evaluates it, reports it, so that the counselor can render appropriate services to him. I think this is a very, very important point to be remembered. One more very important point I want to emphasize is that counseling is not giving advice. Many people have mistaken that counseling is a process of advising. It's not advising. Advice is lavishly available from any person, anywhere. And it satisfies the advisor but annoys the receiver of the advice. I'm sure you might have your own experiences in this. Counseling is an educative process, an empowering process, a process of motivating, a process that enables the person to change his outlook about life, his attitudes, his way of responding to others, to improve his relationship with others, and so forth. Depending upon the case, the nature of counseling also may change. So please remember, it's not an advice-giving process. Instead, it's an empowering process, an educative process. Okay, another thing I want to emphasize that the counselor-counselee relationship and the way the counselor approaches the counselee are very crucial, and I understand our third unit of this block is exclusively based on that. I postponed that discussion. With this introduction, we will enter to the first unit. The first unit under this professional issues in counseling and psychotherapy is the essentials for a counselor or psychotherapist. Why is it necessary that we should have counselors in the society? Cases are very frequent nowadays, problematic cases, I mean. Family discords, divorce cases, consumption of alcoholism, drug addiction, and other substance abuses, violence, and most importantly, depression, stress and depression. It has become the order of the day universally. So cases are increasing. The gravity and frequency of occurrences of these cases are perhaps alarmingly increasing. This itself makes the service of a counselor or a therapist. That's a very, very vital necessity of the present day, I believe. Not only the present day, even before that, an expert counselor can very well help the person to face the problem and overcome the problem with more confidence. Another very important point is that even though you are an educated person, a well-informed person, it is very difficult to find out our own mistakes. If you ask me what is the easiest task in life, I would say finding the mistakes of others. What is the most difficult task? Answer is very clear, finding our own mistakes. Having listened to this presentation, if I ask you to write 10 sentences about me, you will be able to write a page about me, perhaps, even with this short interaction. But suppose I ask you to write 5 sentences about yourself. You will think many times, see, it seems difficult for us. There is a very famous test called WAY test. WAY stands for Who Are You? In this test, a person is required to write some sentences about himself or herself. It's very difficult. In the counseling process, a person who fails to enumerate his problem, evaluate the causes of his problem, can be helped by the counselor who is an expert in doing so, an experienced person who has theoretical foundations to understand the problem in depth. Another most important problem is the disintegration of family relationship. So many cases have been reported. When compared to the olden ages, nowadays, because of the ego conflict between parents, the matrimonial discordia, that's far more. So many problems are there in between. So to set this relationship, counseling can definitely help you. Parent-child relationship also is getting worse when compared to the olden days. Due to the influence of mass media, internet, and many other, so many contributing factors are there. So to improve relationship between parent and child, and also this is most commonly transferred to the school also. There is a theory called transference theory of Sigmund Freud. The attitude towards father or mother will be transferred to the male and female teachers respectively. So in understanding these cases and improving these cases, counseling is essential. Next major point I want to emphasize is the problem of learning difficulties, learning disabilities. These are two different terms. In helping this very, very important problem, a counselor, a service will be definitely useful. Many people, in spite of their high potential, miserably fail to achieve the desired goal, academic goal and professional goals as well. So many inhibitory factors will be there. To overcome these inhibitory factors, the help of a counselor will definitely enable the person. Another point I want to emphasize, very important point I believe, is that even in very severe cases that require medication, counseling will help in motivating, changing attitudes, changing perspectives, in evaluating oneself. Medication will not help that. Even in acute cases, a counselor will be able to go ahead with all these dimensions of personality. So, very important. Counselors' need is very important. I think counseling will boost a person's confidence. It will enable him to diagnose his own problems and enable to set realistic, achievable goals, self-monitoring to achieve these goals, and so forth. So these are the major points I want to emphasize in Unit 1. Unit 2 of this block is self of the counselor or psychotherapist. I understand that the self means the qualities the person should essentially have to become a counselor. We can put it in the form of an abbreviation, CAP, C-A-P, to remember easily. C stands for the cognitive aspects, cognitive base of the counselor. A stands for the effective base of the counselor, and P stands for psychomotor basis. The first C, cognitive, means knowledge base. Knowledge about what? Number one, knowledge about the problem itself. Yeah, there are so many problems. The etiology of the problem, the theoretical aspects of the problem, the researches conducted in that area, the findings of the researchers, the remedial measures, knowledge about all these things. 2, knowledge about the counselee. What are the characteristics of the counselee? What are his requirements? How does he interpret things? Etc. etc. Understanding the counselee, even his developmental processes, how personality development helps in this, in contributing to this problem, that should be understood. That's the knowledge base. You should have a very good theoretical foundation about the various strategies that can be adopted in counseling. So many approaches are there. We have the CBT, or cognitive behavior therapy, therapeutic approaches, rational emotive therapy, psychoanalytic therapy, existential therapy, humanistic therapy, Gestalt therapy. So many approaches are there. Stepwise, stage-wise, techniques to be adopted for rendering counseling under each of these approaches. That should be familiar. Unless he knows this, how can he give? So a counselor, he or she, should essentially have this knowledge base. Okay, we will pass on to A, affective base. This is the emotional aspect of the counselor. Counselors, we are talking about counselors' emotional factors. For the time being, we'll forget about the counseling. Counselor's characteristics. Counselor as a person, his personality characteristics play a vital role in counseling. I think he should be slightly extroverted rather than introvert. An introvert doesn't like to interact with others and share his ideas with others, whereas an extrovert enjoys in doing that. So even this type of personality traits also play a role in rendering counseling. The attitude of the counselor towards counseling, towards his profession, towards himself, the motivation, the dedication, self-confidence, faith in oneself, right? And the counselor's motivation to help, dedication to help, his social commitment, and most important, his moral and ethical values he upholds. These are the effective aspects essential for a counselor. The third P stands for psychomotor or skill-oriented aspects of the counselor. The skill in establishing rapport in interpersonal relationship, to build an environment of psycho-osmosis, is a terminology recently used. Osmosis is an intermixing process of, transferring one's energy, an energy transfusion. Psycho-osmosis. This takes place in a counseling session. The counselor's energy is assimilated by the counselee and vice versa. So, the skill in eliciting, skill in opening the counseling session, skill in developing rapport, skill in motivating, skill in testing and evaluating. Sometimes tests will have to be used, psychological tests, and quantifying the extent of this problem experience. The skill in communicating, the skill in judging the responses of the client, even his body language. For example, the choking of voice, sweating, stammering and stuttering in between responses, facial expressions, even the twist of an eyebrow communicates. To judge it, to evaluate it, to interpret it, all require skills. Again, skills in enabling the client to set realistic and achievable goals, and monitoring, reinforcing. I deliberately use the psychological term reinforcing instead of using the word rewarding. I hope students of MCFT will be able to understand what I mean. So the ability to reinforce, the ability to close the session, the skill in closing the session, that also requires some skill. Even skills are required for analyzing the feedback thereafter, after the counseling session. So, we have now completed the cognitive aspects, the affective aspects, and the psychomotor aspects. This is easy to remember if we classify like this and categorize our abilities into these three broad sessions. Here we will conclude the second unit of this block. Now we will start the third unit, that is relationship between the client and the therapist. This is perhaps the most important aspect in the entire counseling session. I would say the pivotal point, the central point. Once we fail in establishing this relationship, the entire counseling session will be a futile exercise. It's a waste of energy and time of both the counselor and the counselee. So this is very important. This reciprocal relationship between the client and the therapist, we call it a rapport. Look at this diagram. In the diagram, you can see two circles. One is slightly bigger than the other. And please note that the bigger circle represents the counselee and the smaller represents the counselor. The counselor may be an educated person with a postdoctoral degree in his subject, perhaps an experienced person, an elderly person. Agreed. But in the counseling process, the counselee is more important, his involvement. The counselee's self-initiated responses. The counselee's motivation. The counselor's change in attitude and behavior. The counselee's self-evaluation. The counselee's confidence level. Everything is centered around the counselee rather than counselor. That's why these two circles are symbolic to the relationship. The sizes of these circles represent that. Please note the arrows between the two circles. 5 arrows are directed towards the counselee, whereas 10 arrows are directed towards the counselor. What does it mean? The counselor, point number 1, arrow number 1, represents respect. The counselor should respect the unique individuality of the counselee. The counselee is a unique being. No one in the world is exactly like him. That itself is a respectable quality. Perhaps the counselee's behavior may be an antisocial behavior like a drug addiction or kleptomaniac tendencies. Agreed. You need not be positive to that one. You need not respect that behavior. But respect the individual. Of course, you have to communicate that respect, not simply feeling in yourself. Unless you communicate. The more you respect the client, the more he will reciprocate. Respect cannot be demanded and gained. If I ask you to respect me, If at all you had some respect, some element of respect about me, it will vanish. The more you respect, the more you can gain respect. So there are two arrows towards the, see, when we give, you are getting it back and you are getting doubly redoubled respect. The next arrow represents trust. Trust in the faith in the counselee. The counselee can change. The counselee will definitely, I'll be able to bring about changes in the counselee. Counselee is a human being. That trust, that is very important. The trust will be reciprocated, doubly redoubled. The third is the commitment. Commitment to the counselor. That is counselee. That's very important. That's a dedication to the profession, Then only we can be committed to the counseling. It is your moral responsibility to help the counseling. So that's a social responsibility, in fact. So that should be there. You will get it back, doubly redoubled. The last one is the positive attitude towards the counseling. That's very important. Unless you have positive attitude towards the counselee can be positive to you. So this reciprocity, this bondage of relationship is strengthened like a reinforced concrete, with so many iron bars, right? These arrows. And that bridge is called rapport. I think this rapport, once we are successful in establishing this rapport, the relationship, the entire interactive process can be made easy. You'll be able to communicate better. You'll be able to elicit what you want to elicit. That relationship, this friendly relationship, not dominating relationship, that friendly relationship, that helping attitude, that smiling and cheerful appearance, even your body language, these are all very crucial factors in the relationship between the counselor and the counselee. Let's now come to the fourth unit of block 1. The fourth unit is professional ethics and moral values of the counselor. Very, very important. Unless you keep abreast some moral and ethical principles that govern you, how can you become a good counselor? As a professional, you have to uphold these principles. You have to maintain the confidentiality. The client may reveal some personal experiences which he doesn't want to disclose to anyone. So disclosing it to someone else is an unpardonable mistake. His faith should never be violated. The counselee's faith. You have a moral responsibility to protect it. If at all you have to use some data that you collect for some other research purposes, it should be with the consent of the client, getting the permission, prior permission, explaining him that his name will be used anonymously. There see some other names. This is very important. The ethical and moral values also involve the duty we have to discharge in our life for the benefit of our society. The more we extend ourselves, self-extension will definitely bring us immeasurable ecstatic joy. So we close this session, this 4 units of block 1. Wish you best of luck. Thank you for patient listening.